morning to all our distinguished participants, guests, ladies and gentlemen. After the conclusion of our guest of honor's insightful remarks, it now falls on me to welcome you all to the first session of the 35th ASEAN Roundtable. I am Thuzar from the ICS Yusof Ishak Institute, and I shall be moderating the first of the ASEAN Roundtable's 3 sessions this year, which we at ICS and the ASEAN Studies Center hope will be informative, insightful, and interesting to all the friends of ICS and our audiences following developments in this region and how the region responds to these changes for better or worse. So this year's theme, I think, could not be any other topic than COVID-19 and the impact on ASEAN and finding the way forward. The reality that we are conducting the roundtable this year virtually, I think, points to the choices that the current circumstances which compel all of us to take to counter the many challenges of the COVID-19 pandemic. And as our guest of honor has mentioned, the pandemic is more than a health crisis. It has brought economic upheaval. It has highlighted threats to physical safety and life, and also general uncertainty about the future, and throwing into sharp relief the capacity of various governments in the region to respond to the pandemic and the challenges that come along with it. So COVID has exposed institutional shortcomings and also the communication and messaging differences as the various governments in the region struggle to keep up with people's needs and demands for information, for answers, for guidance. And in the opening statements that we have heard this morning from Mr. Choi, from Mr. Christian Eckler, and from our guest of honor, the different member states of ASEAN have risen to these challenges in different ways. As the roundtable is being convened, there are still countries in ASEAN experiencing high numbers or surges in cases, while there are some who can look forward with some cautious hope and optimism towards further relaxation of the restrictions. So the pandemic, it's clear that it does not discriminate, but at the same time, it is certainly not an equalizer. We have seen social and economic divides across various communities in the region widening, and with the us and them divides creating echo chambers and maybe even fueling more feelings of being under threat. And this is where I think observations about vaccine nationalism also come in. So all these uncertainties brought by COVID have also brought out more vocalizations about concerns and questions, as well as the need to manage the barrage of information, which can also mislead or feed on or fuel these vocalizations and uncertainties. And both Mr. Choi and Mr. Christian Eckler have also underscored the importance of keeping abreast of these fast-paced developments in the media and information sphere. So to discuss all these multifaceted challenges for ASEAN, which is the topic of our session this morning, we're starting off the ASEAN Roundtable with a panel of experts who have extensive research experience and therefore deep insights into realities and expectations on the ground. Very briefly, our speakers for this morning are Professor Mely Caballero-Anthony, who is a professor at the S. Rajaratnam School of International Studies, or RSIS, at Nanyang Technological University in Singapore. She heads the RSIS's Center on Non-Traditional Security Studies. We also have with us, joining from Charles Darwin University in Australia, Dr. Jonatan Lassa, who is a senior lecturer there and who also formerly used to be with the RSIS at NTU. And not least, we have with us an old friend of ICS, Dr. Ross Tapsell, senior lecturer and researcher at the Australian National University, and who is also an ICS associate fellow and spent some time with us here a couple of years ago. So without further ado, I would like to hand the virtual floor over to Professor Mely to kick off this session with an overview of what are the challenges for the region and the kind of governance mechanisms that ASEAN has at its disposal, built up over the years to tackle these challenges. Over to you, Mely.
Thank you very much, Mo. And first, let me thank ICs for the invitation to join this panel looking at the multifaceted challenges of COVID-19 in ASEAN. I am delighted really to join my ex-colleague and of course the other speaker, Dr. Tapsell, and looking at the extent to which this pandemic has upended our lives, but at the same time looking at how countries in the region and our organization ASEAN has dealt with it. So I'm supposed to just give a brief overview of how ASEAN has responded to this and identify some of the challenges. But before I dive deep into an account of how ASEAN has dealt with it, just two preliminary points that I'd like to put forward, all dealing with ASEAN and health security. As we all know, this is not the first time that ASEAN has actually had to deal or has been confronted with such a pandemic. But as we also know, this pandemic, COVID-19, has been described as a once-in-a-century kind of pandemic with really, really devastating consequences. And as alluded to earlier by Dr. Choi of ICs, and of course also the senior minister, Dr. Ko, the economic consequences is so devastating that we're actually looking at, a repeat of the depression in the 1930s. But if you look at the history of ASEAN cooperation in health security, it wasn't really until 2003 when the region was confronted with SARS that we can actually see a more visible cooperation among health officials in the region. ASEAN has a number of areas of cooperation that it established since the organization was created in 1967. But in this whole notion of ASEAN's comprehensive security, you might be interested to find out that the notion of health security didn't really appear. That's quite interesting because health security is very much integral to the overall security of the communities and the societies in the region. But that did not enter the ASEAN security lexicon, so to speak. And so it was also interesting to note that health security was always seen as a purely medical issue, and that of course has to be dealt with at the national level. SARS, of course, was a watershed event. It was at that point an unknown virus, and that was also very virulent. Although it only lasted for less than 6 months or so, when it first broke out in early February, and here in the region in March and April, there was so much uncertainty and confusion, given the fact that it was really an unknown virus. But the second point is that although health cooperation did not really start to such extent as we see it now, ASEAN is also known to act fast when faced with a critical existential threat. We always talk about ASEAN, incremental steps, but not when it comes to existential threats. So as a result of SARS and thereafter with other outbreaks, for example, H1N1, H5N1, and then you had MERS, right? ASEAN had quickly put in place important regional mechanism to deal with emerging health threats. And these mechanisms eventually were institutionalized and helped very much in how ASEAN has then dealt with COVID-19. So if someone could please put my first slide. Yeah, so if you look at this regional frameworks that was established, 4 things actually stand out. This is from 2004 to 2016. Now, as a result of SARS, task force were then created to look at what we call highly pathogenic avian influenza outbreaks. So there were task force that were created that eventually became working groups that looked at pathogenic influenza viruses. Following that task force and working group, ASEAN then worked together to come up with what we call the Pandemic Preparedness Plan, starting in 2007 all the way to 2010. Now, Pandemic Preparedness Plan was very important because at the time there was already this idea that the region or the world was not only going to face SARS, was not the only disease outbreak that will happen as a result of more globalized environment, as a result of rapid travel and movements of people, the fact that we live in highly urbanized environment where there's agglomeration of people, with sanitation as a problem, and even at that time the misuse of antibiotics, that we are going to see more and more influenza type pandemics. And it was important that the region, the member states, put in place pandemic preparedness plan. And the purpose of a pandemic preparedness plan is really to prevent, to detect, and to respond to any outbreaks. And ASEAN member states did not only work among themselves, they also reached out to their Northeast Asian neighbors, particularly China, South Korea, and Japan, and that led to the ASEAN +3 mechanism. One is the ASEAN +3 partnership on laboratories, which at that time was very important because when you have a new outbreak of a virus, you needed to be able to test it and to find out what really, and you needed the laboratory to test this, to find out where it belongs in the family of viruses. And following that, you also had the ASEAN +3 epidemiological training networks. So all of this, at least for these 4 important mechanisms, the main aim or objectives then were to ensure that there was a continuous flow of information dealing with public health outbreaks, or what we call public health emergencies of international concern, PHEIEC to be short, and that to be integrated in the overall work of our health officials in the region. In fact, when ASEAN then had its post-2015 health development agenda, the whole notion, Cluster 2, talked about bringing in a prevention and control mechanisms to deal with and to respond to all hazards and emerging threats. From this development, it is fair to say that ASEAN health sector has really been pretty active and were kept busy in managing the health of the region. And so when COVID-19, the information of that actually broke out in the region, ASEAN then further mobilized the more established mechanisms coming from this initial round of frameworks to activate them. Can I have the second slide, please? Okay, so the first thing that I think is important to find out is that there is an emergency operating center network of public health emergency in ASEAN. Now, these are all part and parcel of the mechanisms that have been developed earlier. Its aim was to facilitate immediately timely and accurate information about COVID-19 and ensuring that you have daily situational updates and information on the detection and the prevention of this virus. Now, it's also important to note, and I think it's been reported in the papers, and you can find this in the speeches of the health officials in the region, including most recently the ASEAN Secretary General's speech in September. Now, as early as January, the health officials, because you have this ASEAN +3 network, right? The health officials in China has actually alerted the ASEAN Secretariat about the outbreak of this unknown disease. The ASEAN Secretariat Health Department promptly then informed, right, this focal points of the Emergency Operating Center network, which got together and then reached out to their +3 partners. So as early as mid-January, right, there was already a lot of information flowing to and fro among member states in ASEAN and their +3 networks. And in March, as a result of that, in March, there was then established in ASEAN, the ASEAN Coordinating Council Working Group on Public Health Emergencies, which with the ASEAN Secretary General as the coordinator to facilitate the whole of community and cross-pillar, I underscore cross-pillar approach to address the threats of COVID-19. So this capacity building mechanisms from the Emergency Operating Center network, the virtual, the ASEAN Diaspora Virtual Center, which actually circulates risk analysis assessment reports. Most recently, if you check it, they have a report as recent as yesterday. And then you have public health laboratories and the risk assessment and risk communicating center. All of this are in place to ensure that there's enough information flowing between and among ASEAN members and the +3 countries, and looking at further at various initiatives. With that kind of mechanisms and programs taking place, how has ASEAN actually fared? Well, you could say that at least for the first 3 months of the crisis, you can say from January to March, the ASEAN member states, perhaps the first wave, were actually quite prepared compared to other countries outside the region. And if you look at current statistics, for example, as of yesterday, I think the day before, with a global case of about 40.2 million cases of infection and more than 1.11 million deaths coming from COVID-19, the regional statistics is very much lower. Now, I'm worried when I talk about statistics because you're talking about lives here, but just for purpose of comparison, you basically have ASEAN in terms of total infection registers about 2.1% of the global total infection of 40 million. And when it comes to the number of people that have succumbed to the disease, you have about 1.8% out of the total 1.11 million deaths. So it is, I think, safe to say that ASEAN member states are more or less prepared. They have, individually and as a region, there's enough capacity building going around. Dr. Ko had already highlighted that there were a lot of cooperation taking place, particularly when it comes to providing test kits, because really if you have, there are uneven progress in ASEAN, you still have big countries like Indonesia that continues to register high infection rates, also in the Philippines. And if you look at some of the problems faced by these two major countries, especially in the initial phase of the pandemic, it is really being able to get enough test kits to test its population and to see to the extent to which the pandemic has actually spread among its local community. Given the fact that, as we all know, right, it is not just the visible manifestation of the disease that we see. Most infections nowadays are actually asymptomatic in nature. So the pandemic preparedness response, which is actually meant to test, to isolate and quarantine, to contact trace and all that, all of this have been, I think, have been spread around, have been, in terms of capacity building, there's a lot more going on in the region. And if we didn't have this kind of mechanisms, one could argue that we would have had to reinvent them. So the first point, essentially, when you assess, is that not too bad considering in comparison with others, but certainly not enough, because as we also know, there's we are still very much far from seeing the end of this crisis. Who would have thought that we're already 10 months into this crisis, and we still have to see this pandemic actually being contained. although there are countries in Asia, Singapore, Vietnam, Thailand, and of course you have Hong Kong and Taiwan that more or less have kept this virus under under control. But in a highly globalized environment, we're so interconnected. For as long as there are big outbreaks elsewhere, we still really cannot really feel safe. So moving forward, where are we as far as the kind of cooperation is taking place? Now, apart from these mechanisms, as we all know, and again has highlighted earlier by Dr. Ko, ASEAN was very quick in coming up with some plans. One of that is, of course, the Recovery Fund that was then finalized and announced in the ASEAN Summit. But as far as looking at, enhancing and promoting greater cooperation in health, there are a lot of initiatives being discussed at the moment. And until this mechanisms are fully really announced, my understanding, and I should qualify it from what I have gathered so far in talking to some of the people in the region, is that there is now more there's now greater momentum to look at three important items. One is, of course, the development of what we call the regional reserve medical supply. Now, essentially, we are looking at, before there was this talk about having a stockpile of essential medical supplies, medicines, and therapeutics. If this is actually going to take place, now this is actually not unusual, because in 2009, as a result of H1N1, there was actually a stockpile of vaccines for H1N1, and that was in collaboration, ASEAN in collaboration with its dialogue partner, Japan. So the idea of having a regional stockpile of medicines to deal with this pandemic, and of course future pandemics, is I think now very critical, because as the WHO has mentioned, this is not going to be the end of the pandemics that we're going to see, right? If with the impact of climate change and greater environmental changes, and the fact that many of the pandemics really that we see now are very much a result of zoonotic kind of diseases. So there really has to be more capacity in the region, not just to have, for example, the laboratory expertise, but to have ready a stockpile of medicines, even for prophylactic purposes. The second, and I think which is very important, is the idea of having something similar or akin to an ASEAN Centers for Disease Control, or they call it the establishment of an ASEAN Center for Public Health Emergency and Emerging Diseases. I understand that there's already some feasibility studies that is taking place. And I really very much look forward to this, because it is a logical extension to the kind of mechanisms that is happening at the regional level. And if you have something like a regional disease control where, working together in tandem with the WHO, you can therefore have, a timely and mandatory reporting of disease outbreaks, and at the same time have the capacity to find out or to detect the nature of this virus, and then have all your expertise in the region working with the global experts, and then trying to have a more effective and more rapid way of containing a possible outbreak. There has been a lot of talk about vaccines and the concern about vaccine nationalism. Again, I refer to Dr. Ko's point about why we should really push back against this vaccine nationalism. We see this already. Big countries, especially those that are more resourced, are already having their bilateral arrangements with big pharmaceutical companies that already have vaccines that are, ending their third phase trials. You're talking about the Moderna, the Pfizer's, the AstraZeneca's of this world. And that is something that is really to a great disadvantage of developing countries in the region. So the idea of pooling resources together in ASEAN to not only get hold of these vaccines, right, buy them and have a regional stockpile and distribute them, but more importantly, a more ambitious idea, and this is something that I have written and argued before, that the ASEAN should not just settle for being able to get access to these vaccines, have a pool of these vaccines and distribute it, but really be part of the so-called supply chain of manufacturing of vaccines. Now, if, for example, you have Sinovac in China that is now having close consultation, or I think an agreement with Biopharma in Indonesia to manufacture vaccines, there's no reason why the other pharmaceutical companies in the region cannot have this kind of an arrangement, but the idea is to pool these resources together. Now, ASEAN has shown that it can be ambitious if it wants to, and if this is really something that perhaps can be added into the kinds of initiatives and ideas that are being put forward. As we all know, there is this ASEAN, let me get that term right, the ASEAN Vaccine Security and Self-Reliance Initiative that is being discussed at the moment. I understand the working group is looking at some of the position papers that are being developed by the ASEAN member state concerned, apart from the ASEAN Drug Security Framework. Now, if we already have these ideas in place, surely you can push that further to ensure that, ASEAN as part of a hub, we're talking about ASEAN economics community as a hub of manufacturing in the region. And that can, of course, very well include the possibility of being a manufacturing hub and distribution hub of vaccines. That, as Dr. Ko already said, and as many ASEAN officials and scholars have mentioned, this is really one way where you can, of course, then, promote and establish your credibility as a major, as part of ASEAN's centrality. Now, there is, of course, also the idea of having common protocols, especially when it comes to travel. We all know that ASEAN is a big travel hub. Travel and tourism that business has basically been almost decimated as a result of the crisis. And the sooner there's common protocols on travel are agreed upon by ASEAN member states. It's not in, although there are bilateral arrangements taking place among, for example, Singapore and Vietnam and others, especially for essential travel, these bilateral and plurilateral arrangements can, of course, be regionalized. And this is really the ideal situation, because when you're talking about over 640 million people and its contribution to trade and to travel, right, you have that volume, and you need to be able to recover fast, really, because the economic consequences and the economic uncertainties cannot be allowed to continue further. So with these common protocols for travel being set in place, the sooner the better, then this is again, how you can make the health security in the region more secure. But at the end of the day, you can have as many regional mechanisms as you can, and certainly the ASEAN health sector, they have been very busy together with the working group of public health emergency. You can have all of these ideas in place, but we also should recognize that when it comes to ensuring health security in the region, much of it largely depends on national capacity. Now, the idea of strengthening national health systems has been in the agenda of the ASEAN for the longest time, right? It became more acute when we had SARS in 2003, where you could really see how disadvantaged certain countries were in being able to deal with unknown infectious diseases that are highly pathogenic. Now, if you look at, for example, the state of public health systems in the region, you can see that it's quite...
Mely, I hate to interrupt.
Yeah, I'm almost ending. You can
Thank
see
you.
that it's highly uneven. And so this is where, if you look at the budgets when it comes to health, it's less than 5% of the total budget. And this is perhaps something that member states should really work individually and bilaterally, perhaps, to strengthen these national health systems. Because unless this is put in place, this is basically strengthened, much of the regional initiatives may face serious challenges moving forward. Thank you.
Thank you so much, Mely, for that lovely overview and introduction, opening this first session. I do apologize for interrupting. You know, when we do virtual discussions, I think there is ASEAN way of letting panelists know about their time limits and so on. So I apologize once again for that interruption. But I think when you're setting the context about the regional overview, I couldn't help but think back to the days at the ASEAN Secretariat when we were struggling to put into place the ASEAN +3 Emerging Infectious Diseases Surveillance Program in the wake of SARS that happened in 2003. And it's very encouraging from your presentation to see the progression of the different regional institutional mechanism and the architecture. Clearly, you have highlighted that ASEAN has not been inactive and actually has a regional architecture for responding to the health crises. And the 3 points you highlighted about going forward, what needs to be done in terms of building up more capacity, including the stockpile capacity, is also very important. And your ending point, before I so rudely interrupted, about national strengths and capacities, I think gives a very good segue into the next presentation by Dr. Jonatan Lassa. Jonatan, you have co-authored this paper looking at and analyzing how the different ASEAN countries or the countries in Southeast Asia have responded at the national level, and what are some of the institutional issues and concerns that arose there. So perhaps for the next 15 minutes, you could take us through the findings from that very interesting paper that you published earlier this year. Over to you, Jonatan.
Yeah, so I would like to touch some of the variation of COVID-19 response in ASEAN member states. So thank you, Mely, for introducing the overall overview of the existing regional mechanism in ASEAN in regards to pandemic cooperation. And I think we have got 3 remarks that I think all agrees to one point, that this is a multifaceted problem that goes beyond the traditional departmental approach to public health crisis. So some scholars have argued that when teaching about crisis response in pandemic settings, it's better for us to teach students on how to ask better questions and not to provide them with some sort of doctrines of response that often do not offer solutions in a very big, complex problems like COVID-19. So I think it's undisputable that pandemic, by definition, is a public health emergencies of global scale. What this really means is that the impact is widespread, not only in terms of geographic spread, but also in terms of sectors. So what originally started as a health insecurity of an outbreak or an epidemic, later on becomes a multi-sector transboundary disaster that cannot be tackled simply by traditional departmental approach. In this case, health departments or health ministers. I think we all agree with this. The further questions regarding who should lead, what agency is better in leading the pandemic response becomes not so simple anymore because of the political, economic, social implication of the event that is too big to be managed departmentally.
Jonatan, I apologize to interrupt, but our technical team has highlighted that your volume is low. So could you either speak closer to the microphone or hike up the volume? Thank you. Sorry for the interruption.
No worries. How about now? Right. Right. I'll continue. So one of the variables that we look at in the context of comparative response to COVID in Southeast Asia is declaration of national emergencies. This is a very important step because in theory, the practice of declaration of national emergency or state of emergency allows the governments at the central level to mobilize resources in a faster way. The problem is, so far, there is a big variation of this practice in the region. And so I think overall, this introduction slide, I'll talk about some sort of questions that we probably need to ask for the future learning from COVID-19. So what is the key predictors for ASEAN member state performance in the future pandemic? That is kind of the key questions that I think I would like to ask for everybody to think about, learning from what really happens in countries in Southeast Asia during COVID-19 in the last 9 months. So also the next variables is we kind of looking at crisis leadership practice in Southeast Asia. And so far, I think in ASEAN, there is no textbook regarding crisis leadership. It is some kind of an inconvenient topic, but an important one. We probably need to look at the way leaders perform during COVID-19 from country to country. And as also, when it comes to the questions about leading agency, we also look at the way pandemic preparedness at the regional level has been exercised in the last almost like 20 years, 16 years probably. That is predominantly led by health ministers. So but the empirical data suggests that when pandemic hit countries in the region, very often it is multi-institutional setups such as joint task forces, joint leadership, or joint command system that has been used as strategy to better mobilize resources. This is especially true in the context of large countries such as the Philippines and Indonesia. And this is in contrast to some of the countries that we have seen in the last few months from Brunei, but we also look at the case of other countries that I'll show you in the next slides. Probably I'll just move to the next slide. Yeah, so in the next slide, in this slide, I'll show you some overview of approaches by countries in Southeast Asia. I don't talk about ASEAN here, but because I include Timor-Leste, but let's assume like Southeast Asia is kind of ASEAN as well. Each country developed their own approaches, their own approach to COVID-19. For example, Indonesia initially treated COVID-19 as a public health crisis in early February. It was based on Ministry of Health declaration of public health crisis. And then 2 weeks later, well, almost a month later, they come up with, they increased the status of the public health emergency to be a national disaster status. But strangely, it was kind of declared by National Disaster Management Office. And this exercise of emergency power is pretty much unconventional in many ways because it is often the president who has the highest power to declare a national disaster. But nevertheless, this kind of exercise is needed because it requires some sort of clarity on what leading agencies should coordinate and lead the response. So as you can see, Indonesia up to now the country actually hasn't graduated from the first wave of the pandemic. So if you look at the pandemic course that I provide in this slide, Indonesia is probably the only one, to some degree the Philippines, who haven't managed to be able to control the virus in a expected way. While the rest has been able to secure the first wave, but enter the second wave of the pandemic. And we have to look at these outcomes as an outcome of public policy response. In this case, some of the approaches used by the member states or by the countries needs to be evaluated in context for sure. But we developed some sort of framework to look at the way the countries manage the pandemic. So if you look at a little bit, a small yellow dots there, it suggests that that is the way the country started to use public health measures to deal with the pandemic. But interestingly, countries like Timor-Leste, Laos, Brunei do not actually increase the level of the response into like national disaster response. So they somehow treated the COVID-19 as a public health response, public health crisis, while countries like Indonesia have been pretty much using different model. I'll show you in the next slide. So in the next slide, in this slide, we talk about different strategy. So at least there are 7 strategies that we observe in Southeast Asia. The first one is the head of state try to be in charge, take the command, and increase their power as a kind of the disaster commander, and then followed by state of emergency declaration. This allows the head of state to exercise some sort of power to deal with the COVID-19. Different approaches used by different countries is the creation of special task force. This is a multi-departmental, multi-minister, some sort of whole government approach, but led by specific ministers to deal with the COVID-19. But some countries remains focused on simply putting Minister of Health as a key institutional leading. You can see this in the context of Malaysia and also Myanmar, as well as Brunei. In Singapore, for example, I think it's a little bit of outlier because Minister of Education has been also put together with Minister of Health in dealing with the COVID-19. In the Philippines, the head of state and also army or policy or police are the ones that are seen as the legitimate actors in managing the pandemic. So there are a great variation regarding how this can be done. And as you can see, Minister of Health is not the only player that manages the pandemic. So that is probably one of the reasons why the way the countries have been setting up their response systems are not compatible with the ASEAN mechanism, because ASEAN is pretty much in some ways, when it comes to the pandemic preparedness, it is a little bit departmentalistic in that. So the questions about operability of the ASEAN systems and the member state is something that I think we need to think about for the future pandemic. So I think the lessons that we draw from the case of ASEAN for the moment is, at the moment, there is no ASEAN way of crisis leadership when looking at individual countries. If you look at the way leaders in democratic countries around the world, especially in the West, they do operate differently if you want to compare with leaders in Southeast Asia. So, for example, leaders in Southeast Asia do not always show up in times of emergency, including in democratic countries in ASEAN. So they often do some sort of defacing. So they are not facing the public, but they're kind of avoiding by appointing spokespersons to lead and explain about what's going on during the pandemic. And so this is kind of a puzzle when we look at countries. Like Singapore is quite different from Indonesia when you look at how impression management is showed by the head of states from those countries. We kind of thinking and ask the questions why this is the case and what sort of agenda for crisis leadership lessons that we can actually teach the students for the future. The second one is the different tradition of disaster declaration. So what we found is disaster declaration is not a strong predictor for effective crisis management for COVID-19 in some member states. So for your information, for those of you who are not familiar with disaster declaration as a kind of tradition in disaster response, declaring an emergency before disaster make a landfall in a country is actually a new concept. So even though we know that by January, COVID-19 was still was not actually affecting some of them. I mean, I think only a few countries that register positive cases in January. So most of the countries actually kind of wait for things to emerge before they declare an emergency. So in many cases, what we saw here in ASEAN is member states, including the leaders, wait until it is kind of too late to declare as a kind of national emergency. So the first tradition when disaster can be declared without the event make a landfall in a country is observed in 2012 Hurricane Sandy in the US, where President Barack Obama tried to declare an emergency without waiting for the hurricane to make a landfall. And that was kind of the first experience that we saw at the global level. What we expect in January, if we look at the knowledge that needs to be done, of course, after the event, is that ideally disaster declaration should be made as early as possible in January without waiting for the event. I think that's kind of the big lessons that we need to take going forward, because that will actually affect the quality of crisis communications and risk communications practice. And what we also observe from Southeast Asia during this time is we know that the all division of crisis communication and risk communication is often not useful in the context of COVID-19, but that was kind of the case that we saw in the last 50 years of disaster studies, that there is some sort of separation of risk communication to be associated with pre-disaster communication, and crisis communication is associated with during and after disaster communication. I think there is a need to think about integration of both communication strategies, and that will actually help a lot because during pandemic, at this point of time, we have to conduct both risk and crisis communications all at the same time. Now, I think the last point that I'm going to make here is relating to regional framework that we have at ASEAN level. For me, regional response framework in order to be meaningful as a collective response framework, I think there should be some sort of convergence in the response systems. So what I'm suggesting is that there should be some sort of discussion about interoperability of the country's framework with ASEAN framework. And this is a sort of some kind of inconvenient agenda, but I think we need to think about disaster management beyond departmentalistic approach that it varies, but it varies in a way that does not kind of support anymore with or linking very well with their original response. So in some sense, we think that there is some sort of asymmetric problems, institutional asymmetric problems, because of the way institutions are set up, is set up at regional level, but also the way institutions are set up at country level. I think that is sort of my points that I would like to share. I'm happy to take questions if.
Thank you so much, Jonatan. I think definitely the slide you had about the different national approaches to addressing and communicating the crisis is something that that will need, we might revisit it. But the point that you made in your concluding slide about the need for interoperability between the regional and national responses, as well as how there are still different perceptions about, when does a crisis communication and risk communication hand over to each other. I think those are very important points that perhaps will also lead us into that the next presentation by Ross. Ross, you have been really looking at the impact of social media in Southeast Asian societies, and you've also researched Southeast Asia information societies. And I think there's no better person than you to walk us through how that communication part of COVID-19 is playing out. So the next 15 minutes is yours, Ross, to tell us about what is the situation on the ground, the realities.
Thank you very much. And thank you to ICES for having me back here virtually. It seems like a decade ago since I was there in Singapore. Yes, it seems like a decade ago since I was there in person in Singapore last year. And thank you for having me back virtually. So I'd like to begin by talking just a quick plug. I guess it's cross-promotional material here because it's published by ICES. But a lot of my thoughts today come from editing this book that Aim Sing Peng and I did in ICES last year. And it's just going to be out in the next few weeks. So keep a lookout for that. And a lot of my thoughts today come from editing that, but also from the chapters written in this book by Southeast Asian scholars who are based in Southeast Asia, who are writing about the challenges and responses to the fake news problem in ASEAN. So thanks to them for their hard work in getting chapters in for this book. However, I've updated this presentation to make it more related to COVID specifically, but I think the central argument, a lot of my thinking comes from the central argument in the book. So I guess the first point to make here is that I'm talking about not the pandemic itself, but more this idea of an infodemic. which is another term that gets thrown around a bit, and the idea of the way in which fake news is growing and disinformation is growing, and how social media is changing, and how and in Southeast Asia in particular, our information society is changing. And there's a lot to talk about here, and I can't cover everything in 15 minutes. So what I really want to focus on is the responses from government, and the way in which government has, and those in power, have tried to tackle the no doubt big problem of fake news. There are lots of case studies I could give of fake news. There's a lot of misinformation and disinformation that I could tell you about that is online and has been spread around at the moment. But often these presentations end up being somewhat descriptive. You talk about WhatsApp misinformation that COVID doesn't exist, talking about the crazy cures that you could do if you just use this, that will get rid of COVID, through to 5G towers, causing COVID, etc., etc. And I think probably the more urgent matter here is to talk about the response. So the first point to make is that those in power do tend to blame fake news as the cause of their problems. Now, the king of this, of course, is Donald Trump. And Trump, in many ways, starts this narrative that it's the fake news media that is to blame. So it's by no means an Asean problem. And in fact, it's exacerbated and much worsened in America at the moment. But there's no doubt that there is now a common narrative that leaders tend to deliver when they talk about fake news. And that is that fake news sows discord amongst society, and that it is creating problems that otherwise do not exist in their government or in their rule of the country. And there is a legacy of this, and no doubt when we look back at the history of media in ASEAN, we can see a lot of debate and discussion about the way in which media might sow discord in society and therefore needs to be controlled. The role of so-called communal harmony, which is a really strong theme in pre-digital era media studies around Asian values, and the way in which the legacy of this, of the debate around media control and ombudsman, and the way in which this has changed in post-authoritarian societies. So in a country like Indonesia, this idea of the media needing to nurture the state, but move to communal harmony has been really quite prevalent. And so we see some of this narratives in this discussion of the problem of fake news. Now, the risk here is that I am dismissing fake news as an overstated problem, which I don't want to imply. But I do want to say that it is important that the term fake news and the way in which leaders can dismiss criticism of fake news as being fake news is a growing problem. And that's one concern about the way in which we think about the handling of fake news. So if we dismiss legitimate problems as fake news, or one part of it might be a fake news problem, but there's larger problems, then that doesn't address the real specific issues which might occur in fake news. So as I said, this is not unique to ASEAN. This is a clearly growing problem around the world, but we are seeing this during COVID-19 from ASEAN leaders. The second point to make here is that often it is those in power, and it is ruling governments or the state itself, that are often significant drivers of disinformation. So on the one hand, they're decrying this enormous problem, but on the other hand, they're certainly a central part of it. Again, there's nothing necessarily strictly ASEAN about this problem. The US has this worse than everybody else under Trump. And as you can see in this little snapshot I've got there of Harvard's study analyzing online media stories and the effect that Trump's messaging can have on whether people believe that the virus is a problem. I won't go through all of them. You've probably heard of them, but you understand what I'm talking about here. And so there is, of course, a debate around this globally as well. And I think there's been some interesting cases recently in Europe, including in Germany. But this idea that the leaders can often be the biggest sprouters of disinformation, and those in power can spread misinformation, sometimes unwillingly, in the case of some ministers in Asean, such as the Indonesian health minister basically saying we need to just pray, others talking about, miracle cures, other ministers talking about the vaccine is close to being completed, which then, the president might have to turn around and say, well, actually, let's not rush the vaccine, as President Jokowi said just today. So there are a lot of top-down misinformation that is a factor here when we talk about the way in which leaders might present themselves, such as not wearing a mask, such as going into areas and campaigning in ways which can spread the virus, as we have seen in Malaysia in Sabah election most recently. But the bigger problem here is the infodemic being caused by state-sanctioned disinformation practices. And there's a couple of examples here that have occurred during the pandemic, which are worth highlighting. The first is the Philippines example of the Facebook takedowns of some of the Duterte, pro-Duterte trolls. In this instance, Facebook did something that it rarely does, and that it actually calls out the bad actors here as being state actors, in this case, the Philippines police and military. And this is quite an extraordinary thing for Facebook to do. Facebook doesn't really want to do this. I think it's fair to say they like to be on good terms with national governments. But if they're calling out the police and the army as bad actors here, it is a sign of the way in which disinformation is created and is spread in the Philippines. Duterte, of course, responded by saying that this didn't occur, and he threatened at one point to take down Facebook, and we had this pressure being applied domestically. But this is something, of course, that a lot of independent researchers, media organizations, and various other fact-checking organizations have written about for quite some time. The state-sponsored trolling that occurs in the Philippines, and which is, increasingly growing at local levels. Another case worth highlighting, which has been really prevalent over this pandemic time, has been the Indonesian case of buzzers, which again has been written about by researchers for quite some time. It's not a new discussion, but there's been a lot of recent discussion of it during the current protests in Indonesia, and the viral hashtag that was being spread around Indonesia Butuh Kerja, and Tempo's magazine there was probably the highlight of this, showing this example of the government orchestrating online responses. So all of this suggests that one of the biggest problems of disinformation, and when we're talking about coordinated, or as Facebook likes to call it, a coordinated inauthentic behavior, is their catchphrase there, then we do need to think about the role that governments are playing, and the role that the state and state actors are playing in the driving of sowing of discord, so to speak, and the potential threats that it might play to communal harmony. So these aren't necessarily misinformation, disinformation about the pandemic per se, but it might be material which is clearly designed to promote pro-government agendas which are being criticized, or in the case of Indonesia, there's been a case of hacking of critics and activists online who have criticized the government and their handling of this pandemic. The third and final point then is the question of how to regulate this stuff then, which is often the question that comes up when I give talks on disinformation. How should we regulate? Cherry and George uses a quote which I tend to like, which is this point of, is it regulatory opportunism? Do states take advantage of this so-called infodemic to create difficult laws, to create laws which make it difficult for critics to speak out against their governments? And obviously, Cherry and George would say that would be the case in Singapore, but there's certainly evidence of that elsewhere in ASEAN, where we could see this in Thailand during the current protests going on in Thailand against the monarchy. Just last week, as Anwar Ibrahim looked to take power in Malaysia, there were reports lodged against his majority support claim, saying that he was spreading fake news and sowing discord and using the MCMC law and other existing local laws to say that he needed to be questioned by police, and he was evidently questioned by the police. In Indonesia, there's a current debate around this group KAMI, which is a pro-opposition or an opposition to the government group. You know, my reading of them is that they're largely a sort of a bunch of misfits who are not really this coordinated opposition group looking to bring down the government, but it does seem to be that they are being arrested under certain laws, which is saying allegedly that they are spreading misinformation, disinformation to create riots. So are these cases necessary is the question here, and I'm sure the governments of these countries would say yes, or some of them would say yes, they are. Or is it opportunistic use of these laws now in order to silence critics and in order to crack down on those who might speak out against the government? So overall, the picture that I'm painting here is perhaps not that surprising to all of you. What I'm saying here is that we are seeing a rise in political participation, particularly driven by online movements and by online messages. That we've seen consistently as the graph from The Economist shows here. We're also seeing a decline in civil liberties, and including the civil liberties that citizens once had to express their opinion online. That's clear in ASEAN, but it's also global, as you can see again in this Economist graph. So, and a rapid decline in the past few years and a continual decline as we've seen more prevalent use of laws such as Undang-Undang ITE in Indonesia, such as the use of in more recent times in the Malaysian government, the MCMC, and various other laws such as POFMA in Singapore, which could be used to restrict civil liberties. So this is a concern. And what does this mean? What happens when we sort of get to this juncture where we see rising political participation, but declining civil liberties? Are we ending up going to see some kind of big clash here? Because as people want to express their views more and as they are cracked down upon more, what you get is a more unstable society. So how the information society will shape our immediate future. And there's no doubt that if a vaccine does arrive, everyone's media echo chamber and the bubble that they might be in, their WhatsApp groups, their family groups, their Facebook pages that they follow and that they trust, may decide whether someone will choose to get a vaccine or not. And that matters greatly as to whether a vaccine will work. So that's a huge issue for us as we move forward to hopefully the potential of a vaccine in 2021. An economic crisis, which we're clear, you know, as the other speakers have talked about, and there's no doubt is leading to greater anxiety from citizens and in particular younger citizens, as we've seen most recently in Indonesia with the labour laws and indeed in Thailand. So how will that anxiety be channeled in each country? How will governments channel the anxiety of a more economically uncertain groups, particularly youth groups, particularly student groups, and channel that that it is used positively for the reforms that they are calling for, or to lead to a better society rather than a society which makes them more anxious and indeed perhaps reduces their civil liberties. So protest, dissent and action will be organised, is being organised and will be organised through social media. And unfortunately, the line is being blurred between the so-called fake news peddlers and genuine activists. And if we think of an extreme case being in Indonesia, where an activist, Ravio Patra, was said to be spreading incite to riots, but in fact his WhatsApp was hacked. And it seemed to be pretty clear that this was some kind of operation by a pretty strong actor in that space, not just, you know, a mate or a friend or something like that. And certainly, I guess the key here with all forms of information society is the issue of trust. So it's been long discussed for the past 5 years or so, this idea of a post-truth society where we are moving away from this central idea of facts and credible, reliable information from reliable sources, and moving into a society where people tend to trust the sources that they engage with regularly, that they are perhaps personalized with, as in they know personally, which means WhatsApp groups is really crucial. And also in which groups that they think are not official sources. And sometimes the more that an official source pumps out certain forms of information, the less that they're trusted. But having said all of that and understanding the problems that government face in this space, the key here is that the trust in government is not earned by stifling dissent and dismissing concerns. And that would be my concern with how the infodemic is being handled in ASEAN. So I'll finish there and look forward to questions. Thank you.
Thank you so much, Ross. And yes, the infodemic, I think, is equally challenging as the pandemic when we talk about COVID. Your last slide is so powerful.